We're going to provide you with a simulation of inserting a three-way catheter, manual bladder irrigation, and setting up continual bladder irrigation with our CBI. You're going to follow your Mainline Health policy and Elsevier skill for setting up and inserting a foley. You're going to don your sterile gloves. Place your drape. You're going to disconnect the existing foley. Discard that. Ask your helper, your nurse from the patient's nurse. Open up the sterile catheter. You pull the blue catheter out. You'll notice that the catheter has 3 lumens. The first lumen is the where we will inflate the balloon. This says 30 mLs. We're going to use a 22 to 24 French catheter. We will not use an 18. The middle lumen is where we will connect the Foley bag. Always remember, this is where we're having the urine come out. We're also having the clots come out, so that's where we're going to irrigate. The last lumen is where we will attach the irrigation fluid. So first, we're going to ask for a catheter plug to be dropped on our sterile field. Take the cap off. Insert. We're going to attach our 10 ml sterile water syringe. We have to make sure that we are not using saline, that we are only using sterile water. Now we're going to ask for our Urijet to be placed on our sterile field. We're just using a syringe for today. And we're going to, per policy, clean around the penis, starting at the tip and going down. We're going to insert our Urijet. Discard that. We're going to don a new pair of gloves, sterile gloves. Again, a 22 to 24 French triple lumen catheter. We're going to lubricate the tip of the penis. We're going to begin to insert the catheter without touching the meatus. We're going to instill 10 mLs. We're going to ask our helper to bring over a irrigation kit. And I will, as I'm sterile, I will open the blue chuck and create a sterile field. And I'm going to ask my the nurse, my assistant, to bring over sterile water. And without touching the ends, I'm going to draw up another 10 mLs. Insert that in. Draw up another 10 mLs without touching the sides. Discard. There you have your 30 ml balloon. So again, if I break sterility, I'm going to put new gloves on. I wouldn't be showing you that, so I still have sterile gloves. I'm going to ask my helper to pour normal saline into the graduate and I will have pulled this out so that it remains sterile. I fill this up with 60 mLs. Okay, we're going to say this is 60 mLs. I'm going to disconnect because I'm going to irrigate. I'm going to place 60 another 60 to total 120. And at this point, I'm going to irrigate until there are no more clots. I'm going to ask for a green basin, and carefully, without touching the sides, without splashing, I'm going to again withdraw the clots, discard, and again I'm going to fill it with 120 and continue to pulse back as I pull out the clots. Once all clots are removed, I can then reattach the Foley catheter and ask for the CBI tubing. I'm going to take that tubing out. And I'm going to place this on my sterile field. Going to disconnect the adapter, disconnect the plug, connect the tubing, give the clamped, going to clamp this and assure that my other two clamps are clamped, and we're going to prime the tubing before I connect. Going to prime the tubing and then connect to the catheter. Need to make sure that you are opening the clamp. Tell the patient that they may feel discomfort, and you have to make sure that what is going in is coming out. If you are not getting urine out, if you are seeing more clots, then you may need to irrigate again, and you would start the process over at the manual bladder irrigation part following the Elsevier skill.